My bad. SVU is still playing. Okay, good. All right, y'all. How y'all doing? Well, I'm giving y'all some time to get into the room. All right, get into the room, and I'm going to get into NCLEX Jeopardy. All right, so happy new semester, new year, new me, new year, new NCLEX. But happy 2023 to you guys. This is our first NCLEX Jeopardy of the new year, so that's exciting. And it's also running concurrently with Camp Nursing School. All right, so that is a 2-for-1 treat. So let's go ahead and get into it. Let me go ahead and pull up our topics for today. Is it Mona Lisa? Okay, it sure is. All right, hold on 1 second. Let me pull up our questions from today. There we go. Turn that into a sweet. Is it just me, or is that very like my fault? But it's just very like zoomed in. All right, I think we're good to go. All right, can you guys see that? Give me a thumbs up if you can see that. Thumbs up in the comments if you can see that and you can hear me. I don't know why that looks so zoomed in. I wonder why. I'm gonna put up the questions if they're like that. They shouldn't be like that, but cool, we have thumbs up. All right, so like I said, welcome to NCLEX Jeopardy, the first NCLEX Jeopardy of 2023. All right, so if you guys have not signed up for Camp Nursing School, go do that. Okay, can't see under 400, but we can hear you. Awesome, perfect. You won't need to see the whole screen. This is just so we can know what y'all know what y'all coming into. But once we put on the questions, you'll be able to see the question, just the top part and the answer choices. Okay. If for some reason there is anything that's like cut off, like a word or whatever the case may be, then I will definitely just read it out, just to make sure that you guys can see it. All right. So first things first, hello. I am Nurse Sam of thenursesam.com. You guys may or may not follow me on Instagram and other socials, but here on TikTok, I am at the Nurse Sam 1. Okay, I am a licensed practical nurse turned nurse entrepreneur. All right, I have my own business where I am helping nursing students just like you survive and thrive within nursing school. Okay, so with me and how I'm different from everybody else that tries to get you guys to pass nursing school, I like to incorporate fun. All right, I believe that you retain more when you're entertained. So I like to entertain when I'm teaching. So that's why a lot of our reviews have a lot of gamification elements in it. There's a lot of like friendly competitions, some prizes, those things like that, just to really make it fun. I love associating things with pop culture, just things to make it fun and to really help it stick. Okay, so how are we gonna play NCLEX Jeopardy? All right, so just like you can see the screen right here, you're gonna be able to see the screen with the questions and the answer choices. All right, you're gonna read just like you would on the NCLEX, but you're gonna read the question, the answer choices, and then you're going to answer. Now, this is how you answer that's going to kind of shake things up. All right, so if you want to play for points, all right, if you want to play for points and qualify for points, you have to say what is. Okay, this is very, like I said, Jeopardy style. All right, I don't know if you've ever seen the game show Jeopardy. Okay, but you have to answer everything in a question form. So you have to say what is. All right, this is multiple choice. Yeah, the questions that we have are going to be multiple choice. So how you would answer that is if it's 1, 2, 3, 4, or A, B, C, D. If you want to qualify for points, you would say what is A or what is B. All right, and then just put that in. That lets me know who's here to just, you know, have fun and review, or who's here because they want to win the points. And of course, the person that has the highest amount of points at the end of the game is going to win a free 400-page Ultimate Nursing School bundle. Okay, that is worth $97 regularly, but you can get it for free if you win tonight's game. Okay, and then I'll have a little surprise for you guys at the end of this game as well. All right, so if you want, wait, sorry, 1 second. Okay, cool. All right, does that kind of make everything clear? We're gonna go over the subjects that we're gonna be reviewing within week 1 of Camp Nursing School. So fundamentals, like skills, nutrition, pharmacology, anatomy, and physiology. Pharmacology really spills into week 2 as well, but I just wanted to give you guys kind of like a preliminary round of the pharmacology, just because usually pharmacology can be, you know, 1 semester or it can be 2, okay? So I just want to just make sure that's incorporated, all right? Now, if you guys are ready to get started and ready for your first question, give me a thumbs up down below. All right, thumbs up down below. Thumbs up down below if you are ready to get started with NCLEX Jeopardy. All right, I got 2 thumbs up, thumbs up. Any more thumbs up? Anybody else ready? Anybody else? We have a thumbs up. Okay, cool. If you guys are either starting or resuming your nursing school program this semester, please tag your tag your classmates so you can so they can come in on this fun and free review as well. All right, so let's go ahead and get into our first question. All right, let's start it off with fundamentals for 100. All right, fundamentals for 100. Like I said, the winner, the person with the highest amount of points at the end of this game, we're gonna finish at 8 p.m. It's going to be the winner of a free Ultimate Nursing School bundle. All right, so this is our first question. You don't have to wait for me to read it. You can just read it, read the answers, and then answer. All right, remember, if you want points, you have to say what is. If you don't want points, you can just answer. If you're just here for the review, you can just answer, okay? All right, so fundamentals for 100. Which client is at risk for the development of a sodium level at 130 milliequivalents per liter? 1, the client who is taking diuretics. 2, the client with hyperaldosteronism. 3, the client with Cushing's syndrome. 4, the client who is taking corticosteroids. What is our answer? I'm seeing lots of what is ones, which is the client who's taking diuretics. Okay. Lots of, can somebody tell me why? All right, remember, this is NCLEX prep, so I'm going to be, besides these practice questions, I'm going to be asking you guys questions and really making sure you guys understand the concept, because let me tell you something, NCLEX, whether it's PN or RN, it can get you, okay? It can get you. That's why we do these practice and review questions, review exams, review tests, so we can, once again, practice, all right? A woman of many hats says diluted. What do you mean? What's diluted? Kaylee said urinating out too much sodium. So I'm in a cheer competition and can't hear. This is my son's page, FYI. Noted. It's okay if you can't hear me. You just kind of just read it. This replay will be put on YouTube, just in case for anybody that, you know, wants to rewatch it. Definitely. I'm gonna say water, not sodium. All right, cool. Let's go ahead and see what the answer is. A lot of people are saying 1. So let's go ahead and see if you're correct. Oops, not a sticker. Okay. Quick question, is anybody here on this live, will anybody be taking the current NCLEX? Well, really quick, just tell me which NCLEX you'll be taking. Are you taking the current NCLEX, aka between now and March 31st of this year? Or are you taking the next gen, or will you be taking the next generation NCLEX, which is April 1st, 2023? So which NCLEX will you be taking? Either way, you still want to develop these core skills. just to make sure that you understand the content, because you never know how it's going to ask. So the answer to this question is, drum roll please, y'all knew this. What is one? The client who's taking diuretics. Lots of people taking next gen. Really, Mona Lisa? Awesome. There's a lot of people that's taking, let me put that back up. Sorry, 1 second. A lot of people taking the next gen NCLEX. Perfect. Now, with that being said, let me just give you a little note. Remember, on your next generation NCLEX, you will, for any question that has some kind of lab value, you will be given the reference range for that lab value. Okay, so this says, what is one? The client who's taking diuretics. All right, the normal serum sodium level is 135 to 145. If you're taking the current NCLEX, you're going to need to memorize normal lab value ranges. If you're taking the next generation, you won't need to memorize it. It'll be given to you. However, comma, whether you're taking the current or the next, you still need to know what that means. You still need to know what that may look like, okay? If someone has a low or a high serum sodium level, what cues, what signs and symptoms will they exhibit? Okay, so it's gonna be up to you to know that. All right. So once again, a serum sodium level of 135 to 145, that's normal. Anything lower than 130 is considered, it indicates hyponatremia. Okay, remember your prefixes and suffixes. Okay, hypo means less than, hyper means more than. Okay, so hyponatremia, less sodium than usual, all right, than normal, that can occur in a client taking diuretics. Why? Because diuretics make you diurese. All right, and when you're diuresing, you're urinating a lot. All right, you're losing lots of fluid. And what do we know about sodium? Sodium follows water, or water follows sodium. I think water follows sodium. Yeah, but yeah, what do we know about sodium when it comes to like a dilution? When it comes to like the content within urine or any type of fluid type? Okay, if you're going to be urinating lots of fluid, especially more fluid than you're putting in, then that sodium level, well, that urine period is going to be diluting. Okay, now the word dilute means to, once again, gets like the solvent is getting less and less. All right, you're getting, it's less concentrated. The urine is less concentrated. So when you're diuresing, you're gonna get diluted urine, which means, not concentrated, sorry. Diluted urine means there's lots of content. Hold on, let me see what y'all saying. 1 second. I'm gonna say yes, go me. Awesome. So yes, hyponatremia can occur in the client taking diuretics. All right, just remember, diuretics mean you're diuresing. If you're diuresing, you're urinating lots of fluid out. Okay, so the client taking corticosteroids and the client with hyperaldosteronism or Cushing's syndrome, they're actually at risk for the opposite, which is hypernatremia. Okay, more sodium than fluid. All right, hyponatremia is less sodium than fluid. Okay. All right, so great job for everyone that got that. We pretty much all got that. So great job. Clap your round of applause for all of you guys. All right, like I said, make sure you know the explanation, the rationale why. Okay, so the person that first got that point, the first person to say what is one is Kaylee and Kids. Ooh, OMG, it's Cam. I don't know if you heard me or not, because I know you said that you were at a game, but this is NCLEX Jeopardy, so you have to answer it Jeopardy style. You have to say what is if you want the points, okay? So even though you answered one, you were correct. On the NCLEX, you would have got your points, girl, all that good stuff. However, for this, just because it's a, competition, it's like a fun little review game, and we're actually making it like a friendly competition. We're playing for prizes. We gotta abide by the rules, okay? So great job, OMG, it's Cam. You got it first. However, Kaylee and Kids answered it completely first, okay? So Kaylee and Kids, congratulations. You are the winner of 100 points. Let me get my handy dandy score recorder, okay? All right, so Kaylee and kids. Great job. All right, 100. Like I said, a lot of you guys, I think literally all of you guys got that answer correct. Even though, I want you to note this, even though we are playing for prizes and we're playing for points, the point of this is for you to get through the questions, is to answer the questions correctly. Whether you're first, second, ninth, 54th, it doesn't matter, okay? As long as you answer the question correctly within the allotted amount of time, you're good, you're golden, okay? This is just to make it fun. All right, great job, everybody. I didn't see you, a woman of many hats. I don't see you on my screen for saying what is one. Well, actually, I do see you. You're actually after Kaylee and kids. All right, that's another thing. I can only go by what I see on my screen. So if on my screen it says that Lucy is before Betty, Lucy gets the points. All right, even though it may be some kind of live interruption where the timing is kind of like delayed, so maybe you see something different on your screen as far as response time. I can only go by mine, so don't shoot me. Okay. All right. Was that right about? Perfect. Good. And guys, let's go. Somebody said, how often do you do these? We do these every week, every Thursday, 7 p.m. All right, next question. Wait, which one is that? Hold on. Sure, let's do this one. All right, fundamentals for 300. Remember, the things that we are doing, the topics that we're going over today runs kind of concurrently with what we're going through this week during Camp Nursing School. All right, so fundamentals, nutrition, skills, those things, okay? So this one's fundamentals for 300. All right. Question reads, the nurse is caring for a client with several broken ribs. The client is most likely to experience what type of acid-base imbalance? 1, respiratory acidosis from inadequate ventilation. 2, respiratory alkalosis from anxiety and hypervention. 3, metabolic acidosis from calcium loss due to broken bones. 4, metabolic alkalosis from taking analgesics containing base products. What is our answer? Okay, test taking tip, whenever you have questions like this on whatever exam, nursing school, TEAS, NCLEX, HESI, doesn't matter. Read through the question first, all right? Question, answer choices, and then after you read through the whole thing first, at least go back and reread that last line so you can remind yourself what the question's really asking you, okay? What you don't want to do is, assume, jump the gun, and answer a question answer something that's not being asked of you, okay? That's the quickest way for you to get it wrong, okay? Even if you do know the content. So slow down, read, and kind of think it through. And that's why I always say, okay, depending on what your answer is, I see people saying 1s and 2s. Tell me why, okay? Tell me why the answer is 1 or 2. And this isn't just me being extra saying, tell me why. On the next generation NCLEX, you have something called rationale questions, all right? Rationale, like draw, rationale close, drag and drop, all that. What that means is that you'll have like a fill in the blank. And the first part of the blank will be the answer to the question, and then the second part of the blank will be the rationale. All right, so answer the question, and the second part is, well, why is that answer correct? What evidence-based research practice, what's the rationale as to why this answer is the way it is? Okay, and on the next generation NCLEX, if you get one right and the next one wrong, some of them have partial credit, but just be aware of that, okay? You don't want to get that wrong. All right, so I have somebody saying Airman's Girl said 1, which is respiratory acidosis from inadequate ventilation. That's due to shallow breathing secondary to pain. I know that's right. You better answer that in nursing diagnosis form. You better. What else are y'all saying? Airway. What is 3? That's okay. That is okay if you don't know what it is. Put your best foot forward. All right, so let's go ahead and see what that answer is. What is 1? Because the CO2 is not being exposed to the broken ribs, which is respiratory. Ooh wee! All right. let's go ahead and see what that answer is and see who got it right. 1, 2, 3, or 4. Drum roll, please. And the answer is, what is 1? What is 1? Respiratory acidosis from inadequate ventilation. Here's the best part. Not only did y'all get the answer right, but you also got the rationale right. Okay, I don't know about y'all, but like, it's one thing if I like guess the answer, if I accidentally guess it, but like if I know it for real, okay, I get it correct because I know my stuff. It makes me feel a million times better, a million times more confident. I don't know about y'all, but that's how it is for me. So for everyone that said respiratory acidosis due to the difficulty breathing because of the broken ribs, all right, so that puts them at risk for hypoventilation. They're not able to breathe adequately, so their oxygen's not going to flow as adequately throughout their body. All right, that's going to put them, especially as your body starts to compensate, that can quickly put them into respiratory acidosis. So great job, guys. How do y'all feel? Good job. All right, so once again, the answer was 1. For those that said respiratory alkalosis, don't be upset. Don't be upset. Just look at why you got it wrong, so that next time if you see something like this, you'll be good to go. All right, that's why we have our practice. You get it wrong with me, but then on the NCLEX, you'd be like, "Ooh, I did this at NCLEX Jeopardy. You're not gonna get me, girl." The answer is 1. All right, so respiratory alkalosis is actually associated with hyperventilation. All right, it's when you're breathing too much. Okay, if you have a broken ribs, I don't know about you. I don't know if you ever had a broken rib, but a deep breath is the last thing that you're taking. Okay, all right. And then as far as 3 and 4, it says there are no data in the questions in the question that indicates calcium loss or that the client is taking analgesics containing base products. Okay, don't read into the question. They're gonna give you exactly what you need. Don't take it and run with it and be like, oh, what about this? It could be this. Just answer what the question is asking you, okay? With the information provided, okay? All right, great job, guys. First person to get fundamentals, well, this one correct, and get these 300 points was, one second, 2, Keisha Bell 03. Keisha Bell 03, congratulations and great job. All right, Keisha Bell 03. Perfect. All right, so Keisha Bell, you have 300 points. Kaylee and kids, you're still at 100, but don't fret, everybody. It still can be anyone's game. Okay, we still have like a bunch of points to play and win. There we go. All right. What you're saying? All right, now let's go into the next question. Okay, hold on. All right. Next question. I keep putting up sticks and it's annoying. Facts. All right, now let's go to, let's do nutrition for 300. Let's do nutrition for 300, guys. All right, here we go. Let me see what y'all are saying. Ashley said, I'm taking my NCLEX tomorrow. I'm freaking out. Oh my gosh, why are you on here, girl? Ashley, you supposed to be at the movies. I almost said at the mall. What time is it? I don't know what people do. But you're supposed to be having fun, you know, not studying, but just relaxing your mind, okay? Congratulations. I already know you're finna beast it, girl. Okay. Everybody, please wish Ashley so congratulations, good luck, all that good stuff. Give her all the good energy and the good vibes. So when she takes her NCLEX tomorrow, within 2 days, she can be like, y'all, it's a whole nurse, okay? It's a whole nurse. So congratulations and good luck to you. You got this. All right. Now, this question says nutrition for 300. The nurse is providing dietary teaching to a client who is receiving a potassium-retaining diuretic about foods that are low in potassium. All right, which foods should the nurse include on a list of foods with low potassium content? Apples, carrots, spinach, avocado. What is our answer? What is our answer? Katie said, I took mine today. The weight is giving me a hard time. Oh, I know that weight is something else, girl. I tried to be drunk the entire time. Don't do that. But you got this, boo. All right, guys, what is our answer? Which of these foods, apple, carrot, spinach, avocado, have the lowest, or let me not say have the lowest, but have low potassium content of these? Okay. Which one has low potassium content? All right, we're having the patient receiving a potassium retaining diuretic. So what that means is, well, I'll tell you about that later. I'm getting different answers. I see avocado, I see apple, I see carrots, I see spinach. I literally see one of each. Okay. Nutrition is one of those things that will creep up on you, because a lot of people are so, kind of like bent up and freaking out about like the major things like pharmacology, med surge, those things. But the small things like even nutrition, I'm talking with personal, from personal experience. Okay. I did not pay attention to nutrition, and it surely did almost beat my behind. Okay, that was one mistake that I can say with full confidence. Do not skip out on your nutrition. Why? Because a lot of the nursing considerations and the questions that you'll find on NCLEX have to do with patient education, patient teaching. All right, that's within our scope of practice. It's within our scope as a nurse. Whether RN or LPN, we're going to be teaching. Whether we're initial or reinforcing teaching, we all need to know the same education, the same material and the same content when it comes to this material. All right, so when it comes to nutrition, it's not necessarily asking you, what it's gonna be asking you a lot of patient education questions, patient teaching questions, rather than give me an example of a menu that would be. Actually, no, that's not a good one. I'm going to just retract that last statement. But let me just say that you need to know what foods are low and high in various different vitamins, all that. You need to know what foods are not only high in potassium, but low in potassium. What foods are high in sodium and low in sodium, okay? You're gonna have people that are on opposite sides of that diet, okay? You may have someone with hypertension that can't have too much salt. And then on the other side, you may have someone that needs more salt, okay? All right, let's try. Okay, so this one's, you can't really tell me an example why, you just, is what it is, okay? So let's see what our answer is. What is one apple? The answer is apple. What's the answer? You talking too much. Well, if y'all don't want me talking, okay, and teaching, you can definitely download the app so you can play it by yourself or watch the replays. All right, so... Right, thank you, Free. Thank you, Free. Not y'all ignoring the tips, but they ain't gonna be in my DM saying, oh, help me, help me, help me. I'm trying. I'm trying. All right, so the answer is, what is one apple? All right, so this says one medium apple with skin provides approximately 159 milligrams of potassium per serving. Girl, who's gonna know that? So apples have the lowest potassium content of these choices. They really gave y'all specifics, but if you go to the nutrition study kit within the Ultimate Bundle or the first semester bundle that is available for purchase on my website, if you go to NCLEX diets, you'll see like foods high in potassium, foods low in potassium. And there you go. Because as far as, oh, this one has 120 milligrams, this one has 60. That's not going to be a thing, I promise. All right, so apples has the lowest potassium content of these choices. Carrot has 341. Spinach, raw spinach, has 470, and then avocado has 700. All right, avocados. I hope you knew this, that avocados have high potassium content. Usually, when they're asking, when the NCLEX is asking you guys about high potassium content, it's giving avocado, it's giving banana. So make sure you know at least 2 options that's low in addition to this apple. Okay. All right. All right, let's go to the next question. Let me see what you'll say. The app is called the Nurse Sam app. The Nurse Sam app. Girl, you calm down. All right. The Nurse Sam. If you go to the link in my bio and click where it says download the app, it'll take you straight to whichever one you need to go to for iOS or Windows. All right, next question before y'all tell me to shut up again. All right, and let's do, which one we did? We did this one, this one, this one. What about this one? Nope. Let's do nutrition again, but for 200. Nutrition for 200. You can explain it. Thank you so much. And I'm gonna continue to explain because there's gonna be some people that need that explanation. But I will hurry it up. Okay. Love you so much. Love you so much. All right. So the nurse has a prescription to give 30 milliliters of an antacid to a client through a feeding tube. Which is the priority nursing action? 1, assess tube placement. 2, flush with 30 milliliters of sterile saline. 3, aspirate to determine residual volume. Or 4, administer the antacid by gravity flow. Which is the priority nursing action? All right, whenever y'all see priority within that last sentence, where it says which one is the priority action, which one's the priority invention, whatever, I want you to think about M-A-N, think about man. My man, my man, my man, okay? M is for Maslow's, all right? A is for, what's the A for? ABCs, sorry, my bad. And then N is for the nursing process, AKA ADPI. Think of those things when they're asking you a priority question, okay? Because when they're asking you priority questions, they're not asking you which one's wrong, all right? They're asking you, most likely, all of them are gonna be correct. They're asking you which one you should do initially, which one you should do first, okay? So just think about, MAN, all right? Think about importance, think about client safety being at the top. What's our answer? 1, assess tube placement. 2, flush with 30 milliliters of sterile saline. 3, aspirate to determine residual volume. And then 4, administer the antacid by gravity flow. A lot of people saying 1, but tell me why. A lot of people are saying 1, but I need you to tell me why. Tell me why. Because the tube is the wrong place, it could be dangerous for the patient. It can go down the esophagus. You just need to know the placement for adjusting anything. Assessment is priority, ensure the med will be administered accurately. All right, let's look and see what the answer is. To make sure that it's not in their lungs, because anything that you give that antacid will go into the lung, okay? All right, so let's go ahead and see what that answer is and see who is correct. The answer is, what is 1, assess tube placement? Assess tube placement. Let's look at the rationale. All right, a lot of y'all were correct with this one. It says, although each of the actions and the options is important, told you, evaluation of tube placement is the priority, okay, to prevent aspiration and ensure that the medication delivery will be in the stomach. Some of y'all gave that to me word for word. All right. I'm so proud. I'm so proud. All right. The app again is called the Nurse Sam. The Nurse Sam. All right. When you open that app, go to NCLEX Prep. First thing you'll see is NCLEX Jeopardy. Okay. Click it and you'll be able to play the full game, 25 questions. All right. You won't have me talking. Okay. But it'll still be like an interactive game. You'll go through it. The full 25 questions, 5 categories, 5 questions per category, and just do it self-paced, or you can do it with someone else, but it will be self-paced. It won't be any video or anything like that. Okay. I feel like everyone is the same. You feel like every what is the same. Mind you, the one that's on there now, we change it every week. Okay, we change it after we go through NCLEX Jeopardy. Okay, so right now, what you see right now is the same one that you saw from last week. Okay, well, it's really the first week that we're doing this in 2023. So you're accessing the questions from I think like 2 weeks ago. So tonight will be a full 25 new questions after we get finished with our game tonight. Okay. All right, next question. I'm sorry, about what? Thank you. All right. I obviously can't put it on the app while we're going through for questions because people will cheat. People will cheat. All right, next question, guys. Oh wait, I didn't give points. My fault. First person to say what is 1. Hold on. Oh shit, what'd I do? Oh crap, I did something. I did not mean to do that. All right, who is the first person to get that correct? 1 second, hold on. J is for Jen. J underscore is for Jen. Congratulations, you have 200 points. All right. Next question, guys. Thanks for doing this, very helpful. Oh, thanks. Awesome job. That is on them, but like I said, it's literally changed as soon as we finished. As soon as we finished with these questions, it's changed. All right, next question. Let's do, did I do that one already? I did. Let's do fundamentals. Fundamentals for 300. Next question. All right. Pick me, please. You just have to be first, love. Remember, for anyone that's new, this is NCLEX Jeopardy. So you have to answer what is, and you have to be the first person to answer it correctly in order to get the points. All right. The actual NCLEX is not like this. It's not Jeopardy style. You don't have to be first, and you don't have to say what is. This is just to help you, to have fun, and to help you understand the material. Okay. So this says the nurse is preparing to administer an oral medication to an infant. In which position, the nurse is preparing to administer an oral medication to an infant. In which position should the nurse place the infant? All right, 1, prone, 2, semi-Fowlers, 3, Trendelenburgs, or 4, dorsal recumbent. Somebody said that's on them if they cheat. Yeah, but since we're playing for prizes, I don't want to cheat anybody else out of that opportunity. You can cheat yourself all you want, but as far as, you know, free study guides, I just want to make sure everything's fair. All right, so what is that answer? We're giving an infant oral medication. All right, so what position should the nurse place that infant? If you don't really know your patient positioning, refer to the fundamentals, the Rugrats one, the fundamental study kit. It has a patient positioning sheet all up in there. All right, so let's look and see. After y'all tell me what position, please don't forget to tell me why you got the answer that you got. Sadia said, I just want to say I just got my acceptance call for getting into the nursing program I applied for. Woo, you go, Sadia. Congratulations. Oh, I want to take a screenshot, but it's going to disappear. Oh, that's nice. All right, guys, let me see what y'all saying. Prevents risk for aspiration. Everyone's saying risk for aspiration. You better. All right, so let's see what the answer is. Oh, oops. My bad. It was 200 points. The answer is what is 2? Semi-foulers. Semi-foulers. Now, let's look at why the answer. Because I literally had, I think people chose 1, 2, 3, or 4. Let's see. Are you serious? Hold on. Let me move my head. Okay. I was about to get mad. Move me over here. All right. So the answer is what is 2? Semi-foulers. All right. What is semi-foulers? All right. The nurse should administer oral medications with the infant sitting in an upright position. Why? To prevent aspiration. All right. Especially if the infant cries or resists. All right. They need to be sitting up because you know them. Those peds patients, whether they infant, toddler, whatever, they will fight you, like physically, literally fight you, okay? So semi-foulers, that is an upright position, okay? Does anybody know the degree, when you see semi-foulers, what degree upright is associated with semi-foulers? Ooh, 30 to 45. I'm so proud. I'm so proud. So semi-foulers is not fully upright. Semi-foulers is not high foulers. High foulers is if you're sitting up in the chair like you on Princess Diaries, like that. Semi-foulers is you're relaxed just a little bit, but you're up. You can still eat, drink, whatever. I was semi-foulers sitting in the bed watching Krishan Rock and Blueface show. Okay, so that's semi-foulers versus high foulers. Be aware of those degrees. Semi-foulers is 30 to 45. So y'all knew that. Great job. Trendelenburg. That is when you're on the position when they're on the back with the head lowered, and prone is on the abdomen. So Trendelenburg, on back, okay, with head lowered. So really, it's like you're laying flat, but it's kind of like you're tilting. This is your head, you're tilting back this way. Okay. Prone is on the abdomen. All right. I don't know if you guys have been in nursing school since like COVID days, but even if you weren't, remember like when COVID was really, really bad, like in 2020, one of the main things that they would tell people to help them with breathing is to what? Lie prone. Okay, so that was, prone is the opposite of supine. Who said that? Somebody. Crystal. Prone is the opposite of supine. All right, that helped me as far as visualizations. So supine is just on your back, not tilted like one way or another, just flat on your back. And then prone is the opposite, on your stomach and just face down. Prone is when you're about to go get a massage. Okay, all right. Face down a little thing, little cubby. That's prone. Supine is when you're about to get. All right, so let me go. Oral medications could not be administered to an infant in either one of those positions. And then dorsal recumbent means on the back and flat. So there would be a risk of aspiration with this position. Okay? Y'all, please do not flag me. Croatia said, I remember it as supine, spine down, prone, pouch down. That's cute. That is cute. I like that. I'm a Scorpio, so I prefer the freaky ones, the nasty ones. It helps me remember. I don't know why. All right, so let's go to our next. No, I didn't say who got the question. What is 2? Who got this one first? What is 2? Remember to say what is if you want the points. If you don't want the points and you're just here for the review, then just say the answer. All right. First person to say what is 2. Is it J is for, I think it's J is for Jen again. Yep, sure is. J is for Jen. All right. All right, so you already had 200 points, so you just got another 200 points added to bring your total score up to 400. Great job. All right, guys, next question. How often are these live reviews? They are weekly. They are weekly. Weekly every Thursday at 7 p.m. Okay, if it's something, well, I'll tell you about that later. We did that question. Did we do this one? We did not. All right, Pharmacology 500. This is the big dog, the big boys, okay? The primary healthcare provider writes a prescription for zidovudine. Zidovudine. Did I just have a stroke? But yeah, zidovudine for a client who was admitted to the hospital. The nurse should contact the PHCP to verify the prescription if which finding is noted in the assessment data. 1. History of renal calculi. 2. Complaints of diarrhea. 3. Bone marrow. This is depression, but it's supposed to say suppression, okay? And then 4. Complaints of abdominal discomfort. All right. Remember, after we read through the question and the answer choices, at least go back and reread that last sentence so you can be reminded of what the question's really asking you versus what you assume that it's asking you, okay? The nurse should contact the PHCP to verify the prescription if which finding is noted in the assessment data. All right, whenever that's worded like that, basically that means what's contraindicated to this medication that you came across and now you need to double check. That's basically what that means, okay? So which of these findings would be a cause for concern? In addition to this patient taking the new prescription for zidovudine, whatever. 1, history of renal calculi. 2, complaints of diarrhea. 3, bone marrow suppression or depression. And then 4, complaints of abdominal discomfort. Zidovudine. I don't know about y'all, but what's zidovudine? I don't know what that is. Off the strength, I have no idea what that is. But let me tell you something now. You're not going to know every medication they give you. I feel like on the NCLEX sometimes they give you some where they know you don't know what the fuck that means. But you have to use your test taking strategies and your nursing knowledge to infer what the correct answer is going to be. All right, that's why they say for pharmacology, make sure you learn like the classifications rather than the individual medications. All right, zidovudine. All right, so tell me what your answer is and then tell me why. Okay, now because Nurse Sam, me, all right, I've been a nurse since 2014. I still don't know all the medications there, and I do these weekly with y'all. Don't know what that is, didn't stick to my memory, so what am I gonna do? That's why we practice. That's why we, I almost said rehearse, but that's why we practice. So if I was in nursing school and I had this question and I had no idea what that what this medication means, guess what I'm gonna do? Look it the fuck up. Zidovudine. I'm gonna answer it, sure, but then just so I know what the hell it is, so if I see this again, I'll know what it is that next time. So I'm just gonna Google. She's free. She's 24/7 and 365. You can access her at any point. Okay, I'm gonna just type that into Google, and so I can know what it is. All right. So let's see what y'all are saying. So I'm changing my answer to 3. Whenever I see, Free said, whenever I see meds I don't know, I just assume the worst possible and bone marrow takes the cake. Well, that's one strategy. Let's see if you're right. All right. Lots of people are saying 2 and 3, which is complaints of diarrhea and bone marrow depression. Okay. I was just about to say one of those is way more serious than the other one. And Mo Abney just said it. Bone marrow depression is very serious, and it is. So let's see what our answer is. Thank you, Mo Abney. Bone marrow depression could cause immunodeficiency. But let's get into it. Let's get into it. All right. Boop. So yes, the answer is what is 3? Bone marrow. Why does it keep going from depression to suppression? Okay. But yes, the answer is what is 3. All right. Whether it's suppressed or depressed, that bone marrow is doing something. All right. But it's actually suppression. But yes, it says human or HIV. HIV can cause acquired immunodeficiency syndrome. HIV can cause AIDS, which is a viral disease that destroys T cells, thereby increasing susceptibility to infection and malignancy. Okay, hard pause. Whenever you on pharmacology, you get this a lot for pharmacology. You're gonna get this for like oncology / hematology as far as med-surg goes, but you're gonna get this specific thing a lot. All right. Whenever it comes to a patient that has an immunocompromised system, or a patient that is immunocompromised, it's either going to be because they have HIV or AIDS, they have cancer, they are on chemotherapy. Well, obviously, if you have chemotherapy, you most likely will have cancer, as well as, once again, the bone marrow suppression. Okay, so just know that as far as immunocompromised patients, those are usually where you would see that at least asked by the NCLEX. Okay, so zidovudine, that medication that at least I didn't know, that is a nucleoside reverse transcriptase inhibitor, not remembering that, I'm not gonna lie, that is used in combination, I'm gonna remember this part, that's used in combination with other antiretroviral agents to treat HIV infection. Is zidovudine AZT? AZT. It is. It is. Okay. So this is how I'm going to remember it. That's because this is how I am. So AZT is also zidovudine, which is the medication that we just talked about to help treat HIV infection. I don't know if you've ever seen the musical or the movie musical Rent, but it's about AIDS in New York. Okay. In one of the songs, they say like AZT break. And since then, I'm just like, what's AZT? It's zidovudine, used to treat AIDS. So now I'm going to remember that movie. That's how I'm going to remember it. How are you going to remember it? All right. All right. So a contraindication to the medication is a history of hypersensitivity to this medication. Cautions, though. Cautions, like give this medication with caution, really. But be aware and keep an eye out when you're giving this medication to these people that also have this, and it includes bone marrow suppression, renal and hepatic dysfunction, so that's kidney and liver dysfunction, and conditions that cause decreased hepatic blood flow. All right, hepatic, once again, that means liver. All right. So that's, you want to give that medication sparingly. You want to use it, give it in caution. All right. It's not contraindicated, but it's like double check it. Like, are you sure? Okay. I mean, okay. And then it says a history of renal calculi, diarrhea, and complaints of abdominal discomfort are not contraindications or cautions related to this medication. Another thing, for those of you that were saying, I don't remember what number it was, that we're saying like abdominal discomfort or diarrhea. Diarrhea, all right? Remember, I don't know if y'all have started pharmacology or did your drum cards yet, but remember the side effect, remember the, I would say the medication side effect to like almost every drug. NVD, okay? Nausea, vomiting, diarrhea. So if I have a question and it's asking me which one is the most serious or which one would cause you to be like, hey, doctor or NP or whoever, provider, are you sure you want to give this? It's not going to be abdominal discomfort, and it's not going to be diarrhea. It's not going to be nausea, because that's more than likely going to happen with any medication. It can happen with vitamins. Okay, it depends. So a little diarrhea here and there, you're not gonna. You'll be okay, especially in comparison to a bone marrow suppression. Bone marrow suppression is gonna win each and every time as far as which one's worse. Okay, for diarrhea, discomfort, blah blah blah. That's usually something where you're like having to teach them like, hey, be aware of this. You may feel these side effects, but if you do, just know that they're, although unpleasant, they're expected. Okay, they can happen in anybody. Unpleasant, I know. Girl, you better get you some Pepto-Bismol and call it a day. But it's one or the other. Okay. All right. Who got this one for 500 points? This was. Scroll. A lot of people were stuck between 3 and 4, and hopefully what I just said helped solidify, why it was 3 versus 4. First person to say what is 3 is 1, 2, 3. What is 3? Oh my gosh. Jen, what are you taking at NCLEX? Because it's almost not fair how you are beasting this right now. Okay. So great job to everyone that got 3. First person to say what is 3, however, is J is for Jen. Jen, do you have the Ultimate Nursing School bundle? Because you are killing these points. I just want to just make sure. Okay. But yes, the answer is what is 3. So hopefully that helped you guys. Jay said, what is I bought for Christmas? Do you have NCLEX Arcade, Jen? Let me know if you have an NCLEX Arcade. Jen, take your test now, honey. I don't know where you at in nursing school, but you can stop. You can test out. All right, next question, guys. Okay. Jen said she does have. So Jen, you can either I'm trying to see what else that we don't have. Like, do you have any of my products that's not included in the Ultimate bundle? All right. While we're figuring that out, let's go to our last question, guys. And it is this one. Not imposter. All right. Pharmacology for 100, and this is our last one. All right. So wait, let me add your points, Jen. So Jen, you're now at 900. Keisha Bell, you're at 300. Kaylee and Kids, you're at 100. And then we have one more question to go. This one's for 100 points. All right, so the nurse has a prescription to give a first dose of hydrochlorothiazide to an assigned client. The nurse would question the prescription if the client has a history of allergy to which item? 1, iodine. 2, shellfish. 3, penicillin. 4, sulfa medications. Ooh, I see something just off rip just because I know my test taking strategies. But we'll go over it. We will totally go over it. I'm gonna see who gets it. In addition to telling me your answer, make sure to tell me why. Please tell me why. Thank you, TikTok Tosh. I'm not sure. And Crystal Garcia, thank you. I was waiting for someone to get it, and I'm glad it was y'all. I'm glad. I see you too, Deja. Great job. Great job of noticing that. All right. Test taking tip. So sorry. Usually I wait for these, but I'm gonna just let y'all know. All right. When you have multiple choice question, especially one where it's 4 multiple choice answers to choose from, if you have 2 answers that are either the exact same, well, saying the same thing or mean the same, it's more than likely not one of those answers. Remember, this is multiple choice, so it's going to be one of the answers out of, instead of select all that apply. If you know that you're only going to be choosing one answer and you see 2 answers that are the same or basically similar, saying the same thing, you know that it can't be one of those. Okay, because you can only choose one answer. So if 2 are saying the same thing, it can't be that. So 1 and 2, you should know that 1 and 2, go ahead and cross that off your list because they say the same thing. Now, if this was select all apply, it'd be different, but it's not. That's why it's very important to know what kind of question and know how to answer these types of questions even before, outside the content. Okay, remember, to pass NCLEX, whether current, next gen, future, anything, all right, whatever. You need to know the strategy, all right, like test taking tips and strategies. You also need to know the content. You cannot pass the NCLEX, RN or PN, with only one. You can know all the content in the world, but no strategy, and vice versa. You can know all the strategies in the world with no content. So you need a healthy mix of both. All right, so I say that to just drop that into your spirit, okay? All right, so let's see what that answer is. Look at everybody saying 4. Oh, I'm so proud. All right, so let's see what that answer is. Oh my God, it is 4. I would not have known. I would not have known. Great job, everybody. So yes, the answer is 4 sulfa medications. All right, and here's the rationale behind why. Okay, other than, we know that 1 and 2 were the same thing, so we could eliminate that. Thiazide diuretics, okay? Specifically, remember the one that we were given in the question was hydrochlorothiazide, HCTZ, okay? Those are sulfa-based medications, okay? So therefore, if you have a sulfa-based medication and you're prescribing it to someone with a sulfa allergy, what do you think is going to happen? An allergic reaction. They are at risk for an allergic reaction, absolutely. All right, so that sulfa allergy must be communicated to the pharmacist, PHCP, as well as the nurse. All right, so everything else, those were not contraindications for administering that medication. All right, but yes, that is very important to know. Thiazide is sulfa-based, okay? I thought you were trying to be funny and put sulfa instead. That's so funny that you said that, madam, because when I was making these questions, I was like, I'm thinking about sulfur. I'm about to put a sulfur icon. And I'm glad I didn't. Me knowing because I'm allergic to sulfur. Oh my gosh, you knew that because you're allergic to sulfur medication. That's good. Hey, that's pretty good. What's that? Why not penicillin? So yeah, they're not related. Okay, perfect. All right, so this is kind of fun. Let's do this again, same time next week. Absolutely, 7 p.m. next Thursday. That's when we do it, okay? All right, so the person who answered this question first. What is 4? Wait, hold on. It was Boo Boo Kakaka? Kakaka. Yep, Boo Boo Kakaka. I don't know how to pronounce it, but good. Great job, Boo Boo. Boo Boo. Awesome. All right, so you have 100 points. And the person, because it's the end of our game, the person that has the most amount of points is, y'all can guess, J is for Jen. So awesome job, Jay. Great job. Because you already have pretty much everything. If you don't have everything, let me know. But if you do have everything, do you want to pass it along to the second runner-up, the prize? Or do you want to use it for something else that maybe you don't have? You have NCLEX Arcade, you have the bundle. Do you have nursing care plans, and do you have critical care? Okay, cool. This is in their school. All right, there you go. All right, so J is for Jen. I'm gonna call you Jen. Jen, I hope you have Instagram, because I'm not sure if TikTok will allow private messages if we aren't following one another. I'm not sure. But if you have Instagram, please DM me on Instagram. DM me your full name, first and last, as well as a good email address so I can send that prize over to you. Great job, great job, great job. All right, so yes, congratulations to Jen for winning first place, and congratulations to everybody for whether you placed or not, but for everyone that was getting those answers correct. Round of applause. Okay, wasn't that way more fun than sitting in front of your computer? No shade, you were, but you were boring as hell to me. Like I couldn't use UWorld. I literally fell asleep each and every time I did it. So I needed something a little bit more lively, entertaining. So that's why I had to become what I didn't have when I was in nursing school. So, but yeah, tell me what you guys think. Was this way more fun and effective than, you know, sitting by yourself and taking, you know, UWorld? Not saying that's always a bad thing. It depends on your learning style, but just, you know, let me know how it was for you. Okay. Like I said, we do these every Thursday at 7 p.m. right here on Tiki Talkies, the Ticks and the Talks. Okay, 7 p.m. Eastern Standard Time. If for some reason it can't be a live, it'll either be the live version will either be rescheduled, or I'll still give you guys the 25 questions within the app. And speaking of that, let me go ahead and update the app now to reflect the questions from today. Well, the full game. We only did about, I think like 8 or 9 questions. And on the app, it'll have 25, the full 25. Okay, so let me go ahead and update that now. Remember, the app is called the Nurse Sam. You can search it in your app stores, or you can just go to the link in my bio, or go to thenursesam.com and click where it says download the app, wherever. But the link is provided for you guys if you don't want to search your iOS or Android Play stores, Apple Store, whatever stores, app stores. But yes, the app once again is called the Nurse Sam. All right, when you open that app, you're gonna go to NCLEX Prep. It's like a category, NCLEX Prep. And in NCLEX Prep, the first thing you'll see is going to be NCLEX Jeopardy mobile version. All right, NCLEX Jeopardy, the mobile version, is exclusive to our mobile app. So if you want to play those 25 questions weekly, then you would have to download the app. Okay. If you want to, in addition to that, come to the live where we do about 10 questions for about an hour, have at it. Have at it. The more the merrier. I'm someone that needs like live stimulation, if that makes sense. Like I need someone, like I need a group. Like I can't just do it by myself. Sometimes I need to, but more than especially for me and my learning style, like I need not a crowd, but I need a group to study with. I don't know if you're the same way. But that's why I do it both ways. If you're like me, you prefer like a group setting when you're studying and learning, come to our lives. And or if you prefer like, oh, it's 2 o'clock in the morning, let me get some NCLEX Prep in, let me open my NCLEX Jeopardy app, or let me open the Nurse Sam app and go to NCLEX Jeopardy game and give it to my homeboy, my cousin, whoever, and have them test me on it. Like it's whatever floats your boat is what we're gonna do. All right. So do you also do next gen style questions? We are starting to incorporate that. Okay. So remember, this is also. Hold on. Let me look at what questions y'all are saying. It's like being roofied. What's like being roofied? Let me look. I relaxed. All right, wait, hold on, let me look. Awesome, perfect. I was just looking through what y'all was saying. Y'all was saying that you're live, that you're glad that I'm doing the live sessions, in addition to the app one as well. Love it. And then Bree said, do you, well, P. Morrell said, will sulfur-algae ever go away? I don't think so. I don't think so. It can come later on in life, but once you get it, you can't, it's not really something that's usually taken off. Bree said, do you also do next gen style questions? Because this is 2023 and we are now counting down towards the next gen NCLEX, we are just going to start incorporating that next gen style NCLEX. Also, now that we are officially finished with tonight's NCLEX Jeopardy. Oh, this is finished. We're done. We're done. This is the last time. Yeah, this is the last question. Sorry, let me take it off. Let me put it here. Okay, and that's really, really big. All right, but yeah, that's the conclusion of our NCLEX Jeopardy for this week. Come back next week for same time, same place for more questions. All right. Once again, download the app if you want to play more questions. We only did about 8 or 9. If you want to play the full 25 questions, download the app. Okay. Let me actually do that. That's what I was doing here. I'm going to do that on here with you guys. Okay. All right, so while I'm doing that, I also want to let you guys know that it is our first day of our first week of Camp Nursing School, as you can see here. All right, we did Camp Nursing School back in August for fall semester, and it was when I say hit, it was a hit. So I want to do it again for those that were starting and or continuing for spring semester. All right, registration is now open. It's also free. Okay, there we go. Yes, registration is now open. It's also free to register. We're gonna put that right here. Sure. Link in my bio is the first thing that you'll see when you click the link in my bio. Click that, and you'll be getting 2 emails. One email right away that'll give you kind of like an overview, and then the second email you're gonna get like an informational, educational. Here's what you should review, and then I think as far as the newsletter for tonight, you should get that at 9 p.m. I believe. I think that's when we had that set to go out at 9 p.m. if it hadn't already gone out. If it hadn't gone out already, if it's not in your emails, then it's going to go out at 9 p.m. That's going to be your newsletter, your weekly newsletter. It's going to give you your activities for the week. It's going to give you your topics for the week. It's going to give you your quizzes, your worksheets. The links will be in that PDF, so make sure you pay attention to that, okay? Like I said, you should be getting that. If you haven't gotten it already, you should be getting it by 9 p.m. Especially for those that are freshly signing up. We'll be sending out again for everyone for the new registrants at 9 p.m. Eastern Standard Time, so like 30 minutes. Okay, this was the first real activity. It was us coming to live and kind of going through this practice question practice round. And then when you get your weekly newsletters, you'll kind of get more direction as far as what you can do to practice those different things. Like I said, it'll be like worksheets, it'll be journal prompts, it'll be like quizzes, and then we meet again on Sunday, this Sunday, so the 15th. We meet again Sunday the 15th at 7 p.m. On Instagram. I'm gonna try to do it on TikTok too. But we meet then at 7 p.m. and we're gonna talk about next generation style. We're gonna go through a case study together. All right, and it's gonna be about fundamentals. But remember, the thing about next generation NCLEX case studies is that for every case study, you're gonna have 6 questions. So on the next generation NCLEX, you're gonna get 3 total, everybody is gonna get 3 total case studies, okay? For a total of 18 questions specific to those case studies, okay? But on Sunday, we're gonna go through 1 case study, which will be 6 questions, and we're gonna go through it as a group together, just like kind of we did here, but instead of individualized traditional NCLEX style questions, we're gonna pay specialized attention and focus on the next generation style new item types, okay? But once again, majority of that information is going to be given to you again in the email that you're going to get with the folder, not the folder, with the newsletter. All right, so thank y'all so much for joining me tonight. Do we get syllabus for campus? I just answered you, Material Girl. God, I think that's awesome. We'll be back next. Awesome. I'm so glad that you guys enjoyed it. But if you did miss it, if you want to see the other, maybe watch other replays, check out my YouTube. There's like literally over 100 replays that we've uploaded from last year. Well, really the last 2 years alone. So NCLEX Jeopardy, NT's Jeopardy questions, ATIT's entrance exam questions. You're gonna be right there on my YouTube. My YouTube is at the Nurse Sam TV. Link also in my bio. If you just want to watch more of those and get more practice in. If not, I will see y'all next week at 7 p.m. right here. Make sure y'all sign up for Camp Nursing School. And if you have any questions, just hit me up, email support, and I will talk to y'all later. Let me see if I have any questions before I go. I'm gonna go eat. Perfect. All right, so thank you guys. I will see y'all next week.